Good morning. It's my honor to be here. I want to thank the scientific committee to invite me to present this work. So what about we listen from excellent surgeons, conservative and surgically options for rotator cuff injuries. So we will show today a new perspective for rotator cuff reconstruction rehabilitation. We will hear new terms like periodization, like neural contributions, like arthrogenic muscle inhibition. So in the recent years, we have different improvements in rehabilitation devices and reconstructive techniques for rotator cuff injury. But the last consensus for rehabilitation of a rotator cuff is back in 2016 from US. So for 8 years, we don't have any consensus what is happening with the rehabilitation of the rotator cuff reconstruction. So let's start with the basics. What is periodization? Why we use this term? And this term is coming from the sports training. It's coming from sports performance. And periodization is a plan. So the physical therapist needs a plan after the surgeon make all the work, and this plan must be training or rehab, because those two terms, especially when we have to deal with athletes, they are splitting together. So when I have a competition or I have a long period rehabilitation plan, like rotator cuff or ACL, the term we use is macrocycle. So a 6-month period of rehabilitation plan, we can call it microcycle. But the smaller blocks, like 1 month, we can call it mesocycle. And the much smaller blocks, we can call it microcycles. So the periodization is based on the theory of Hans Selye. Hans Selye is a physiologist back in the 30s. He's the first person, the first scientist, talk about the stress in the body, scientifically, of course. And the idea behind his theory, which is modern till today, is that the systems, like the human body, will adapt to any changes they might experience to meet the demands of the stressors. So a stressor can be the pain, a rehabilitation plan, or an injury. So if we consider that after the first post-operative day till the complete return to sporting activities for an athlete or a weekend warrior, we can refer to the microcycle. This is the big plan. And this is how we can deal with the mesocycles and the microcycles. And why we use the term periodization here? Because we need a new consensus in this field. And for example, we can say that the first mesocycle goal is from the patient or the athlete to regain full range of motion. The second mesocycle might focus on strength or proprioception. And the third mesocycle could concentrate on neuromuscular control of the joint. We have different models of periodization. The athletic trainers, they use linear, non-linear, especially orthopedic doctors, when they refer a patient, Some of them, they sent a paper according to the surgical technique they used, that they write or explain what they want to do in every week or every month post-surgery. This is a linear plan. That means every patient must do the same, but it's not every patient the same. So that's why we use the non-linear plan. That means the non-linear plan goes according to the patient needs, the patient outcomes. Does he have pain? Maybe he goes faster than the others. So maybe we need to change the plan. That's a non-linear periodization plan. In our clinics, and now we have a paper ahead of print for rotator cuff injuries, we use the reverse linear neuroperiodization plan. Why reverse linear? Because we use different aspects of, let's call it brain training or neuromotor performance in every aspect of those mesocycles. So let's assume we have a 6-month rehab program for RCR. And in the first stage, we deal with range of motion, pain, and edema. What else we can do? We can work on strength, on muscle power, force development, on sensory motor performance and proprioception, and especially we can make special drills, I will show you later, which are dependent for the activity of the patient or the sports demanding. If he plays tennis, we need a different sensory motor performance drills. And of course, we need then to decide when this athlete or patient will go with safety return to sport. So we need criteria for this. After a surgery or an injury on the rotator cuff, we deal with arthrogenic muscle inhibition phenomenon. So we must deal with this phenomenon because in many patients create many problems in their rehabilitation plan. And we can see here how this phenomenon is explained from a knee injury, ACL mostly. So we can see this is a complex clinical impairment, and this impairment comes when the joint does not give the good afferent information to the brain. We have reflexive muscle inhibition, and we have deficiencies in somatosensation in the patients. And of course, all these create neuroplastic alterations in the brain. We have many, since 2015, evidence and research regarding ACL, as we call it, a brain trauma, but we don't have nothing regarding the rotator cuff. So Grooms and al. From Ohio University.
Excuse me, you have 1 minute left.
Okay, thank you. So what Grooms saw that the ACL patients compare with non-injured control, have problem with the motor planning in the brain after an fMRI, sensory processing and visual motor control areas. So the corticospinal tract does not give the proper information to the joint. And when detecting those deficits, we can send the athlete or the patient safer, and we can do injury prevention at its best. This is our work on periodization and the International Journal of Sports Physical Therapy for anterior cruciate ligament rehabilitation. And we use, with this model, virtual reality, laser beams, stroboscopic glasses, and metronomes. You see on the picture an athlete works on eye-hand coordination, the other again with stroboscopic glasses, and below is a VR concept we use. So thus we use reverse linear neuroperiodization model. It's a new model that incorporates all these neuromotor training in the patient and athletes. So, for conclusion, we have neurosystem challenges and motor control challenges now in the rehabilitation. We must deal with AMI, and the periodization is a plan for safe recovery and rehabilitation for our patients. Thank you.